Okay.
Knock, knock, knock. Come in. Hi. Shh. Hello. Hello. My name is Lydia Tonis. I'm a nursing student at University of West Florida. I'm coming to do a health assessment on you. Let me go ahead and grab your name and date of birth. I'm checking it with the orders.
It's Ivana Paz, 2/14/1989.
Okay, wonderful. All right, sounds good. Well, hi, Ivana. I just got a couple of questions for you before we get started. I'm going to make sure that I provide patient privacy, and I'm making sure I don't have any IV lines or oxygen or other safety concerns in the room. And if your bed was down low, I'd go ahead and raise it up to a comfortable working height for myself. You're on a table, so this is comfortable for me. All right, a few questions for you before we begin. What year is it right now?
2018.
And where are you?
UWF Hospital.
Okay, and do you have any cultural or religious concerns before we get started? No. Now, I am going to be touching you throughout the exam. Is that okay with you?
That's fine.
Okay. On a scale of 1 to 10, 0 being the least pain, 10 being a lot of pain, what is your pain level?
0.
Okay, and do you need to void, as I will be assessing and palpating your abdomen?
No, okay.
You don't need to void right now? Okay. And I am going to be just observing your general appearance throughout. And let's see, if you don't mind, please remove your shirt, your shoes, and your socks. And since you have glasses on, I'm going to have you remove those, even if you have these for vision. Let's remove those. I will give them back to you if you need them before we walk.
Okay.
Let me know if you need assistance. Okay, wonderful. There. Okay, good. And so, if you don't mind, even though you're actually in a good position, just for our video purposes, I am going to have you properly laid up here. So, first thing I'm looking for is your hair and your scalp. If you don't mind, tilt your head down. I'm inspecting for your hair color, which is a blonde brown. The quantity is not too thick or thin. Normal distribution. You don't exactly have any spots there. There's no lesions, and I am going to touch your hair to look for pediculosis. Okay, turn your head that way. I don't see any pediculosis. Okay, wonderful. And I am going to go ahead and touch your head, and I'm palpating for masses, any tenderness, and your scalp mobility, each of what seems normal. Very good. And I'm going to be assessing your skin throughout each body part. But when I do color, rashes, edema, lesions, temperature, turgor, and texture. Okay. First, we're going to look at your face. So you just look at me straight on. I see the size. It's a normal shape. It's symmetrical and position. Everything is midline. I'm going to palpate for tenderness, muscle tone, your different lymph nodes, and for T&J function. And we're going to palpate your sinuses while I'm here as well. Do you feel any tenderness here? No? No? Okay, and your sinuses, which are here and here. I am going to have you clench your teeth really hard. Okay, good. I want you to open and close your mouth. That helps me assess your T&J function, and I don't feel any clicking. Very good. Now to assess your lymph nodes, we are going to palpate here. These are your preocular ones. Are they tender at all? No. No, those are your post-auricular ones. Your tonsillar ones are down here. They don't feel enlarged. Your submandibular are down here. Your submental. Very good. And I am going to save the neck assessment for just a moment. Do you wear contacts? I know you had glasses on, but do you wear contacts at all? No. Is your vision blurry at all?
No.
No? Okay, good. Next, I need to go ahead and look at your eyes. All right, I'm looking at your sclera, your cornea, your pupil, and your iris. In fact, I am going to ask you to follow this right here to assess your Cardinal Fields of gaze. So look at this pen. I want you to go here and here. Okay, your eyes are moving smoothly and together. I don't see any weakness in your gaze. Okay, good. I'm going to have you keep following it. I'm going to test for combination, and I should see your eyes go in. Okay, very good. All right. And before I palpate your eye and your globe, I'm going to put this at the bridge of your nose. I'm looking to see if you have the corneal light reflex, which means that you have a little star that's equal in both eyes, which it is. So I want you to look at this ear, and I'm going to test your pupil reflex, right light. And good, it is brisk, and it starts at 3, brisk. Okay, good. Now I'm going to look for consensualism. So as I'm shining the light on this side, I'm looking at your other one. Okay, good. And it is consensual. Very good. Okay. So let me go ahead and palpate your eyes. Close your eyes, please. Does that feel tender? No. No. Lacrimal ducts are not edematous. Okay, wonderful. All right. Next, I'm going to move to your ears. I'm just going to pull your hair back there. The skin condition looks good. I don't see any drainage. In fact, no drainage. Can you look that other direction? There is no drainage there. I don't see any lesions. And when I touch them, do they feel tender?
No.
Okay, good. I'm going to say a word. I want you to repeat it back to me. But first, plug up that one ear. Chicken.
Chicken.
Passing.
Passing.
Very good. Wonderful. And so I need to inspect your nose. I see that it is midline. The shape is symmetrical. The size will be appropriate. And if you don't mind, look upward. And I'm going to look to see if it is. If you have a deviated septum, which you do not, there is no discharge up there, and you don't have any nasal flaring, which would indicate respiratory distress. Very good. Now I've already palpated your sinuses, so we're going to move on to your lips and your tongue. If you can, give me a big smile. Okay, it is symmetrical. I want you to open up your mouth, stick your tongue out, okay, and say ah.
Ah.
Okay, good. Your palate rises equally. And while I'm in here, I'm looking at your teeth condition. You're good. The gums are not edematous. You don't have any masses in there that you can feel. Okay, good. One thing I wanted to also do on your eyes is have you pull your eyelids down because I'm going to assess the conjunctiva. Okay, good. Next, so shape, texture, condition. Next, we're going to assess your neck, if you don't mind. I would like you to look upward toward the sky. Good. Look down. That would be hyperextension, and that is flexion. I want you to go right and left. Very good. I'm now going to go ahead and touch you. We can assess your trachea by me putting my hands here and having you swallow. Swallow. Okay, good. And after I assess the trachea, I can also assess the thyroid by feeling here, and it's not enlarged and tender, or I can assess you from the back, and I do not feel an enlarged thyroid. Okay, very good. I would like to palpate the carotids, making sure to do one at a time. Okay. Feel good. And to assess for jugular venous distension, I would put you in a 45-degree angle, have you turn your head, hold your breath, and I would be looking for a distended jugular vein. At this time, we're going to move on to assessing the lymph nodes, and you have several lymph nodes in your neck. We have the superficial circular, which are kind of in front, our deep cervical, our posterior cervical, and our supraclavicular. Were any of those tender? I felt that they were mobile and not enlarged. Very good. Couple more questions while I have you in this position. Have you been experiencing any fatigue, activity intolerance, high blood pressure, maybe chest pain, or just shortness of breath or dizziness?
No.
Okay. Have you ever been diagnosed with a heart condition, stroke, maybe COPD or sleep apnea?
No.
Do you have a family history of lung disease or maybe heart disease?
No.
Are you currently taking medications for heart disease?
No.
No? Okay, good. So while I have your gown down or your shirt off, I'm definitely looking at your skin. I'm inspecting your chest, your precordium for color. It should be the same color as the rest of your skin. If there's any scars, and assessing for pulsations at your PMI. It is normal to have a pulsation if you're thin. Also, I'm going to be inspecting your respiratory system for the shape and symmetry of with your rib cage, your respiratory effort, which I see is non-labored, it would be normal, and it is symmetrical as well whenever you take a deep breath in. Good. My next thing I need to do is palpate. I'm going to be palpating the precordium for masses, tenderness, thrills or heaves, and then for the respiratory system, tenderness and masses as well. I'm going to go ahead and palpate the cardiac system at this point. Okay, I don't feel anything. Okay. Okay, good. And then here as well. I'm going to have you lift up your arms. Okay, good. Let me just go ahead and listen. I'm going to listen to your lungs first and your heart. Or you can listen to your heart first, it doesn't really matter. Okay? I'm going to make sure to use the diaphragm. Alright, so this is your second intercostal space. This is your aortic. Take a deep breath. And actually, I apologize, I'm going to have you breathe normal. It's your aortic valve, your pulmonic valve, your point, tricuspid, mitral. Okay, and while I'm here, I am going to at the same time. Good. Now I'm going to listen to your lungs. Deep breath. Side 1. Side 2. 3. 4. 5. 6. And 7. Deep breath. And if I would have you lift up your breast. So 8. Very good. I'm now going to listen to the side. If you don't mind, lift up this arm. I'm going to listen near the scapula. Take a deep breath. Good. One toward the front. One to the bottom. Good. And twist again for me. Okay. Near the scapula. Front. And back. All right, great. So I'm going to go ahead and move over to the back. And when I'm in the back, I'm going to be also looking for the shape, the symmetry. Yeah, in fact, go ahead and twist for me. Yeah. Your rhythm, which I noted earlier, was going to be regular and not irregular. Your effort, and it looks symmetrical. And the first thing I'm going to do is, after I'm observing, I'm going to palpate everything. Tender, no masses there. Okay, good. To check for chest excursion, I am going to put my hands right here and then breathe all your air out. Okay, and breathe in. I'm looking to see that my hands, okay, move out symmetrically. Very good. Now, please say 99.
99, 99,
Louder.
99, 99.
Okay, very good. That was just to see if you had any excessive vibrations, and they decrease as I move down. Now I'm going to go ahead and listen to you. Do you have a cough?
No.
No? If you did have a cough, I would assess and ask what did your mucus production look like if you are able to get it up or not. So I would evaluate the secretions. So using the diaphragm, deep breath. Good. 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 Again. 6, 7, and 8. Okay. If you were unable to sit up, I would definitely want to note the head of your bed if it was 45 degrees. So if you don't mind, go ahead and turn back around so I can assess your upper extremities. There you go. All right. We'll be looking at your skin and the condition. Let's see, it feels warm. Wonderful. I'm going to feel your brachial pulses bilaterally. I can feel those. I'm going to feel the pulses. Those are regular. They're strong, so +2. Okay, good. I'm going to do a skin Turgor assessment right there. Now, when I look at your hands, I'm going to assess for your cap refill in your nails. Your nails are smooth and pink, and your cap refill is less than 2 seconds, which is good. Since I'm done by your hands already, I'm going to go ahead and have you test your strength. So I want you to squeeze my hands really hard. Good. Oh, okay. All right. I want you to push me. Okay, good. And now pull me. Okay, excellent. Now at this point, I would like you to raise your arms. Good. I would like you to put your arms back this way. Good. And now I would like you to have your arms up. And this is checking for internal, external rotation. Okay, very good. I didn't notice any stiffness in your shoulders. Did you have any pain? No. Okay. Now to test your hands, if you don't mind, hold your hands out like this. Make a fist straight out. I want you to abduct your fingers like this. I want you to adduct your fingers by bringing together. I need you to flex for me. Good. Come back around. Now extend. And I want you to hyperextend for me. Any pain when you do that? No. No, good. And then please touch your fingers. They are smooth and coordinated. Okay, good. Okay. Check your Turgor, Field, nail condition. Okay. Now before I lay you down, I do have a couple more questions. When was your last bowel movement?
Yesterday.
Okay. What is your normal frequency of bowel movements?
Usually once a day.
Okay. And I know you voided earlier, so I don't have to ask you that question. Any pain, urgency, or difficulty when you urinate? No. No. In fact, when you do urinate, what is the color or characteristics of it? Is it yellow, brown,
Clear and yellow.
clear and yellow? Okay, good. And I noticed you don't have a catheter in place, so that's good. Go ahead and lay on down for me. You need some help. Okay. And we are going to roll up your shirt and make sure the camera is set. Okay, good. Okay. So, not your long shoes. All right, the first assessment I do is inspecting the skin. You know, it can be a lighter color, but I notice it's the same skin color. There's no rashes, no lesions. And next I'm going to note any kind of peristalsis. I don't see any respiratory movements, which are not in excess, so that's good. And there's no obvious pulsations. So the next thing I need to do is go ahead and auscultate with the diaphragm. 2 more. You don't have any pain in your abdomen? Okay, so I can start at your right upper quadrant. And I should hear bowel sounds every 2 to 3 seconds. If it was greater than that, I would say you're hyperactive. If it was less than that, I would say they're hypoactive. Okay, I'm going to turn it over to the bowel side and we'll listen for an aortic early. I don't hear any swishing, so that is a good thing. Okay, I'm going to go ahead and begin percussing. And percussing, I'm using my third finger, third digit over here. Same pad. I want to hear a tympanic type of sound, not a dull sound. Okay, so that all feels good. I'm just palpating. I know you do not have any distended bladder. Let me go ahead and actually palpate here. I'm just feeling for tenderness, masses. If she did note tenderness, I would say that area for last. And circular motions with 2 hands. Okay, very good. And then bladder part 2. To assess the general area, we would do that last when we would do our ADLs or any kind of pericare. That's when we're going to assess that. I'll go ahead and put your shirt down. While you are lying here, I'm going to ask you to straighten your legs out. Okay, there you go. Is that uncomfortable?
No.
You're okay? So I'm going to test your hip flexion. Go ahead and bring your knee up for me. Okay, let's do external rotation, knee out, and internal rotation, knee in. Very good, and you can bring it back down. All right, hip flexion again, knee up, inside, internal rotation, external rotation, good, and foot down. Very nice. I'm going to have you now do hip abduction by bringing your leg outward. Good, and bring it now across your other foot. Good. If that was uncomfortable, I would take your other leg and push it off the table. All right, now I want you to do abduction. In this way for adduction, good, you can bring it back. If you don't mind, Go ahead and point your toes for good plantar flexion, dorsiflexion. Pull your toes up. Good. I want you to do eversion, where you kind of roll out. Good. Do inversion. Very good. Version. And then I would like you to do an abduction. Just kind of point your toes that way. Good. Now point your toes inward, which is adduction. Very good. You're able to do all of those well. All right. I didn't note any stiffness or limited range of motion. How about for you? No? Okay. I'm going to go ahead and have you sit up for me. Okay. And I'm going to have you pull your legs over. Now, for video purposes, I am going to have you kind of hold a leg up a little bit, but I want to normally assess your legs in this dangling position when I do a lower extremity assessment. Okay, so with your legs dangling, I'm looking at your skin condition, the color, the texture. I'm going to check temperature. They both feel warm, a little cool down there. They're warm. I don't notice any edema. Yep, and you're smooth. Well, so very smooth. All right. First thing I'm going to do is check your pulses. All right, testing in here. Normally I would probably be squatting, so I'm not bending and hurting my back, but I'm checking there. All right, and to assess for edema, I can push in. All right, wonderful. To check your nails for cap refill, I'm just going to squeeze, and it's coming within 2 seconds, so that's a good. And your nails are smooth and well kept. All right, wonderful. Now, with your legs dangling, I'm going to have you close your eyes to check your sensation. All right, where am I touching you?
This side.
Good. Where am I touching you?
This side.
Good. And I should be assessing this on your feet. Okay, good. So that was your test to light touch. To test for painful stimuli, if you were unable to feel that, I would take my thumb and push really hard the base of your nail. Okay, I'm going to push. And you would either let me know that you feel that. I would do that bilaterally, or some patients may even retract. Another way to assess pain in a person would be a trapezius pinch, or even a sternal rub to let them know, to see if they're arousable. That's how I would assess for pain. Okay, I want to see how strong your leg is. So you can actually drop your feet at this point, which technically they would be down already, but on this leg, lift your knee up. Woo, good. And then pull your knee down. Good. Knee up, knee down. Okay, good. I'm going to have you, so let me see. All right, pull your toes up to your nose. This is dorsiflexion, and then plant. Good. That's plantar flexion. They were equal bilaterally, so that's good. All right. Next, we need to assess using the long side of the hammer, your patellar reflex. And so I'm just going to tap it. Tap. Whenever I do this, I make sure to stand at the side, not with my legs open, just in case somebody would have a hyper reflex. So stand at the side and tap right below the kneecap. Good. You have good reflexes. Awesome. Now, using this point, I'm going to test your Babinski reflex. And so, squatting down or pulling a person's foot up. We're going to go at the bottom of your heel, and I'm just going to kind of draw on up. And a normal sensation, a normal reflex is that toes curl downward, as there. It would be abnormal if your toes fanned out. That would indicate you have cervicular dysfunction. Okay. My pinky twitched. Good. Okay. So less movement here. The big thing is they didn't fan out, so that was good. Okay. While you're in this position, I'm going to have you with your right foot tap your toe. Tap, tap, tap with mine. Okay, good. And then tap with this one. Tap, tap, tap. Only for this assessment, I'm having her lift the leg so you can see that she's tapping her feet in time. Okay, good. Now I'm going to have you get out of bed. I'm just going to observe how you can get out without assistance. Okay. Wonderful. You seem to move pretty well with good strength. Please turn around, and I'm going to actually have you touch your toes. I'm going to assess for any kind of spinal deformities such as scoliosis. Okay, I do not see any. Come back up for me. Now, in this In this room, we're going to have you take about 5 paces that direction, turn around and come back. I'm looking to see if she has any gait disturbances, that her base of support is 2 to 4 inches, and that her stride is 12 to 14 inches. If I had any concerns that she was wobbly or not able to move, I would not ask her to do any further assessments, but since she moved very well, I am going to have you turn around and walk heel to toe for me. I'm looking for wobbling, but she is not. Good, turn around, and you can do that again. All right, wonderful. Go ahead and stand right here, and I'm going to test for Romberg's. This is where you close your eyes, and I'm looking to see if she's going to start getting unbalanced. She is not, so you have a negative Romberg's finding. You can open up your eyes. Go ahead and sit back up here. Good. Wonderful. That completes my assessment. You had no abnormal findings. Your skin was good. Eyes are clear. I checked your corneal reflex whenever I was looking in your eyes. You had the star equally. Are you comfortable?
I am comfortable.
Here's your call bell. Make sure you have that in place. I am going to exit, provide patient privacy. I'm going to go document my findings. If you have any more questions, just use your call bell and let me know.
All right, thank you.
Thank you.